Images may not be suitable for young children.
Today's show is full of great tips to help you back your way into better health because it's all about the backside of your body.
You know, and as a plastic surgeon, I get this in my office every day. I mean, everybody wants a nice butt. And, you know, there are surgical options, but it's tough. Anatomically, you went through that very nicely in your graphic. To get a beautiful proportioned bottom isn't always that easy. And usually we first suggest go exercise, but isolating those muscles specifically to get a great look to your bottom isn't always that easy. So that's why we plastic surgeons are always trying to reinvent the wheel and find a better bottom.
But this is a solution that is really on the forefront. More and more options when it comes to shaping your derriere. And now a Miami plastic surgeon has developed a new procedure to help women boost their booty, and it's called the Miami Thong lift.
I live in Miami with one of the most beautiful beaches around the world. The weather's hot, everything's hot, beautiful bodies everywhere, wearing thong bikinis, showing off their booties. There's a huge Latin community, and it's really easy to mistake a woman from Miami with Kim Kardashian or J-Lo. I love to go to the beach, but it's really hard because whenever I'm on a bikini, I'm really self-conscious. I always wear like a boy short, I have curves in the wrong places. I have a flat butt, the love handles, and especially after my pregnancy, every time I look at the mirror, I'm not happy with what I'm seeing. As Latin women, we are known for the curves, the big booties, and I want to reflect that. I would love to wear a thong bikini, but right now, no way.
There's 4 different buttock shapes. The A, the V, the round shape, the square shape. Follow is a square shape. Essentially what we need to do is we need to turn her into an A shape or inverted heart appearance of the buttock. With the Miami Thong lift, it's not just about making it bigger, it's about making it shapelier and prettier.
She's got a really nice waist here. It's a little bit on the high side, so I'm going to bring that waist down. I want to put fat there, and then we'll add volume in the buttock. I'm going to start off by going into the deep layer first to assess the quality of the fat. So right now I'm mainly just harvesting. Now what we're going to do is separate the fluid from the fat. We're trying to collect 10 cc syringes for the superficial injections, and we're trying to collect the 60 for more of the intramuscular injections. I'm going to add fat to equalize the volumes in the buttock. I'm going to cut along dentate, which is the color difference between the rectum and the skin, so it follows lateral to the vulva. That's the Miami Thong lift.
That's what I call a bottom, doctor. and with me are Fallon and her doctor, Dr. Constantino Mendieta, from no less Miami Beach, South Beach. I mean, and this is what women want, what people want.
I got to tell you,
Miami.
It's sweeping really America, honestly, not only here, but internationally. People are flying in from all over the world to get this done. And the Brazilian buttock is just about adding fat and making the buttock bigger, but the Miami Thong lift, it's much bigger than that. It's about really evaluating the entire buttock. It's about reshaping, resculpting, recontouring. So essentially, many times patients will have a little bit of excess in the lower part of the buttock area, and it gives it a dirty diaper look. So the Miami Thong lift will put a little scar inside of the crease, right down the center of San Andreas Fault. And what that'll do is it allows me to suction that area. That skin will sometimes retract, but sometimes it doesn't. So sometimes I got to put a little scar that goes right down the center area. And even though it's in an area where there's a whole lot of shaking going on, that scar tends to heal pretty darn well.
So you're getting some tightening, and then, of course, volume is a big part of it.
Volume is a huge part of it.
And we want to get into that in 1 second. Let's remind everybody how our patient looked before surgery. We're going to compare that with how she looks now. So this is a result that has lasted. We also want to show this in profile. So let's take a look at how she looked from the side.
Gave her a lot of volume.
Nice. So tell us, I mean, a big part of this was the volume that you put in. So tell us exactly how much you put in.
Well, in Fallon's case, when she first presented, she had very little fat, so I had to send her to booty camp. That means that they got to really get...
So you're telling people that you need more fat to gain...
She actually gained about 20 pounds, really, to get the procedure done. And then what we did is we ended up placing almost 800 cc's into each buttock. 800 cc's is about 1.5 pounds of booty.
I want you to turn around again. Wow. I want you to hold those up next to each one of these
Here we go, Ray.
cheeks.
I don't want to spill any of our fat.
And you showed how we do that now with fine needles. I mean, think about it. So it's taking fat from one part of the body and putting it in those parts of the buttock where you want to shape and lift.
And is this something that will now last forever? Obviously, it's her own fat, but is it, or is this something that will have to be reshaped in the future?
If I can get that fat cell to survive, and it takes about 3 to 6 months for that to happen, but if it does survive, then that fat cell should live for however long it's destined to live. In my opinion, it's destined to live forever because these are areas that we could never get rid of. Love handles, lower belly. As we age, it gets worse. It doesn't get better.
So it's taking the fat from one area and put it where we want it.
So
that's exactly right.
The Miami Thong lift. Thank you so very much for showing it to us today. Thong, thanks for being here. Appreciate it. Coming up, 5 fast